Hi everyone, thank you for tuning in to this presentation. My name is Costa and I'm a research associate here at CAR. A big focus of my work today has been to understand the psychological impact of predominantly craniofacial conditions like craniosynostosis, which is what we'll be talking about today, and to improve the psychological support and healthcare that is available for those affected by such conditions. Today I'll be speaking with you about a project which aimed to explore the psychological health in caregivers of children affected by craniosynostosis. This project was a collaboration between CAR and a charity called Headlines Craniofacial Support, which is a leading UK charity supporting those affected by craniosynostosis. The project was funded by a small grant awarded by the Vocational Training Charitable Trust Foundation, otherwise known as the VTCT Foundation. And this year-long study was one of the first to examine the psychological impact of parenting a child with craniosynostosis, and I'm really excited to share some of the findings with you today. So craniosynostosis is a complex craniofacial condition which affects around 1 in every 2,000 live births. So in the UK, that means approximately 350 children are born with craniosynostosis every year. Craniosynostosis occurs when 2 or more of the cranial plates fuse together prematurely, and it can be non-syndromic, or at times, much rarer, it can be associated with additional syndromes like 8-Pert syndrome or Crouzon syndrome. With regards to treatment, surgical intervention is very often required early on, but we often see kind of ongoing multidisciplinary treatment as well for those affected by craniosynostosis. In the UK, care for those affected by this condition is delivered by 4 regional specialist units with additional community-based support offered by Headlines, the charity that I had mentioned earlier. As I say, Headlines is a UK-wide organisation and it became a registered charity in 1996. Over the years, Headlines has done amazing work to develop a range of services and support, and this includes a helpline, a welfare fund, information leaflets and other resources. They host family events, fundraising activities, and they've also got e-newsletters for their members, and they've also got conferences too that people can attend. So when we think about the impact of craniosynostosis on people affected by the condition, it's a condition that can bring about many challenges for those affected, and these might include coping with looking different, teasing and bullying, especially kind of during the earlier school years, unwanted questions and or staring from the public. Some people with craniosynostosis might experience speech, hearing, communication, educational or behavioural difficulties too. They might experience challenges around managing and navigating social and romantic relationships. And there's also, of course, the need to manage a long-term and quite complex treatment pathway too throughout their life. And by extension then, parents and caregivers are also affected by these challenges, as of course they're often the main support or source of support for their child. Parents may also face additional challenges such as having to manage their own feelings of shock, guilt, grief or worry once their child is diagnosed, increased parenting stress, having to process a wealth of medical information, and also having to make really tricky treatment-related decisions for their child. And also there could be a negative impact on their own social and romantic relationships and overall psychosocial well-being. And we know from the research that parent well-being is imperative for child well-being, and indeed parent psychological distress has been shown to be a key risk factor for poor medical and psychological outcomes in children. So when we think about it that way, it's really important that parents and caregivers of children with craniosynostosis are adequately supported so that they can in turn appropriately support their child. And this is something that we think is very, very important, which is why I'm here speaking with you today about this project. Unfortunately, generally research on craniosynostosis is lacking and there's not a whole bunch out there, but the research that is out there suggests that there are key challenges that exist for parents and caregivers of children with craniosynostosis. But as I say, knowledge is lacking, and so what that means is that the knowledge about best ways to support parents and indeed children is limited. And so the support that we're able to offer is often not evidence-based, or as evidence-based as we would like. So to answer this question, we designed an online mixed method survey, and it consisted of standardized questions, often used in other health and psychological settings, as well as free text boxes where participants could write as much or as little as they liked. Topics for parents of children with craniosynostosis included their experiences of their child's treatment, their own well-being and social and romantic relationships, and also their experiences of support services. We've also, as I said, had some standardized questions such as the revised life orientation test, which assesses optimism and pessimism, the hospital anxiety and depression scale, which assesses depression and anxiety levels, relationship satisfaction scale, which assesses the ways in which people perceive their own relationships, the Connor-Davidson resilience scale, which assesses perceived sense of resilience, and the perceived stress scale, which looks at levels of stress among parents in this case. Before launching the study, we held a PI, so Public Involvement Workshop in London, and that was all the way back in September 2019. And that workshop was attended by 10 adults born with craniosynostosis, 8 family members, 1 consultant clinical psychologist, 2 headline staff members, as well as myself and my colleague Nicola from CAR. And in this workshop, we were able to gather invaluable feedback on the survey design, study materials, the specific questions that we were asking in the survey. And based on that feedback, we were able to amend our research and make sure that it's really well received by the community. After we had received institutional ethical approval, the survey was finally launched in October 2019, and it remained open until April 2020. So with regards to recruitment, we primarily recruited through headlines, so their social media pages, their website, and other member communications such as emails and newsletters. In order to be able to take part, parents and caregivers had to be over the age of 16, they had to be currently living in the UK, and they also had to have a good level of written English, so to be able to complete the survey. We also only included parents whose children had been born in the UK, as we acknowledged the likely variation in healthcare between different countries. So overall, we had 111 parents take part in the survey. Most of those parents were white UK-born mothers with an average age of 41 years old. Over half were employed at the time of completing the survey, and a very big proportion were married. Almost 90% also told us that they had no known family history of craniosynostosis. So in terms of findings, thinking about the standardized outcome measures, we were able to compare our own results to data available from the general population. We found that parents in our study had lower levels of resilience, lower levels of optimism, and also less satisfaction with their relationships. In addition to that, we found that our parents reported higher levels of stress, more symptoms of anxiety, and also more symptoms of depression. And worryingly, despite these reported challenges, less than 30% of our sample had reported having received or accessed psychological support too. Within the qualitative data, many parents commented on the traumatic birth experience. The time of birth seemed to be a very difficult time for many of the parents in our survey. They also talked about a missed or delayed diagnosis and the challenges associated with that, having to fight for diagnosis, having to chase and kind of do their own kind of discovery in the area. And not surprisingly, many parents talk to us about the high degree of kind of the emotional distress and a large emotional impact on them at the time of diagnosis. A lot of parents also mentioned kind of a burden of care, so having to take time off work, having to attend many hospital appointments, having to pay for hotel accommodations if the hospital was far from their home. The kind of burden of care is something that came through quite strongly. A lot of parents talk to us about their perceived sense of a need to fight and advocate for their child, so constantly having to be in this combative mode, as this parent says in this example quote. Many parents also talked about distress, particularly during their child's treatment. So a lot of comments coming through that were indicative of potentially medical trauma too. That seemed to be a very challenging time for parents. A lot of parents talk to us about a perceived lack of awareness and understanding among non-specialist healthcare professionals, so midwives, general practitioners, GPs, and having to educate the healthcare professionals about their child's condition in order to be able to access that care, and that seemed to be particularly challenging for parents. On the flip side, many parents told us about their positive experience with specialist healthcare professionals, so the healthcare professionals that were specialists in craniofacial conditions such as craniosynostosis. With regards to the impact on the family, a lot of parents told us about the impact that it had on the family unit as a whole, so not only on their child and them as parents, but also on grandparents and siblings too. And overall, parents felt that there was just a greater need for more support and information. Parents wanted more information, parents wanted more support, and that came through quite strongly. But it wasn't all bad, and many parents also talked to us about the positive consequences of having faced these challenges and having a child with craniosynostosis. So one positive consequence was an increased sense of empathy for others, and that came through as relevant for the whole family. So a lot of parents mentioned about unaffected siblings just being more caring and empathetic towards others because of what they saw their own sibling go through. Parents talked about an increased confidence in their own parenting skills, stronger family bonds, kind of satisfaction in feeling like they can help other people in similar positions and situations, a big sense of gratitude towards medical professionals who helped them and their child, an increased sense of resilience, even though the outcome data said that parents in our sample had less resilience than the general population. Parents said that they felt more resilient because of everything that they had gone through, and a big sense of pride for their child and everything that they have gone through and overcome too. A couple of things worth noting about just our methodology. So as I had mentioned, parents were recruited through the charity Headlines, and this was by design because this project was in collaboration with Headlines. However, it's important to note that the subset of parents who completed the survey through Headlines could not be assumed to be representative of the entire kind of craniosynostosis population. Furthermore, most were white UK-born mothers. So what that means is that fathers, black and minority ethnic parents, and also parents of children born outside of the UK, so non-British children, were underrepresented in our data. So from that, our advice is that more representative samples are needed. A way to do this might be to work closely with the 4 specialist units which engage with all families in the UK seeking NHS treatment and support for their child's condition. This is likely, as I say, the most efficient way to access and target the population as a whole. So we think it's really important that the specialist craniofacial units routinely collect patient and family data, including that related to the psychological outcomes, to better allow for this type of research to continue in the future and in a more representative way. Our design was also cross-sectional, which means that we weren't able to accurately comment on likely fluctuations through the lifespan. And as such, from that, we advise that longitudinal explorations of this parent group are warranted. Finally, we did explore differences between the outcomes of parents whose children had syndromic craniosynostosis and whose children had non-syndromic cases, and we were able to find no significant differences. We also explored the differences between parents of older children, some of which were adults now, and younger children, very young children, and we also found no differences. We would assume that there would be differences either due to changes in healthcare or changes in, time has passed, and maybe that has allowed for better adjustment. But as I say, we were not able to find those differences, and this might be in part due to the limited sample size. So as I mentioned before, overall we just recommend that larger sample sizes are needed in future to be able to examine these potential variations across subgroups. Overall, this study was the first of its kind and demonstrates the potential and significant impact on the well-being of the family as a whole. There is a clear need for routine psychological assessment of the family so that we can better identify those who might be struggling and prevent any difficulties from getting worse or indeed persisting over long periods of time. And this is something that we have and will continue to speak with the NHS teams about and campaigning for in the future, of course. On that note, my colleague Nicola is kind of working on an ongoing collaboration with Headlines, and will be producing a new booklet for parents which outlines a range of common psychological challenges and points parents to various sources of information and support. The booklet will be developed in collaboration with parent representatives and specialist clinical psychologists, and is an exciting first step in addressing parents' needs, particularly around the time of diagnosis and leading up to the first surgery, which seems to be particularly challenging. Finally, we will also be looking at other ways in which Headlines can provide additional and varied support for parents and young families. So thank you so much for listening to my presentation and being interested in this study. As I said, the study has provided for the first time research evidence to demonstrate the long-term challenges associated with parenting a child with craniosynostosis, and we would like to stress the need for ongoing psychological support. It's been a pleasure to present to you today and to work with my colleagues at CAR and Headlines on this project. A huge thank you to our funders, the Vocational Training Charitable Trust Foundation, for making this work possible, and a big thank you to all that took part in the study. And thank you for so generously sharing your experiences with us. If you have any questions at all, please feel free to reach out to me. My email is on the screen, but I'll also be attending the Q&A session so we can discuss then. Thank you so much for listening.